am officially recording. Uh, hey, Praxy, it's Faye. It's good to see you. I'm just letting you know we're recording and that's okay with you, right?
That's fine.
Okay, so I'm going to go through and thanks a ton for doing this. This means a lot to not only me and Lifebox, but really to all of the colleagues you have in Kenya and the rest of East Africa, that hopefully by hearing about what you're facing on the front line that can be shared and will benefit all of them as well, and all the patients that they can take care of.
Mm-hmm.
All
Yeah,
right.
yeah.
So the first thing is, if you can, first of all, just for the purposes of the recording, say
Yes.
your name and maybe tell a little bit about who you are and maybe how we know each other, because that's a good story.
Okay, so my name is Praxy, is a short form of Praxidis. I'm a pediatric anesthetist based in Nairobi, Kenya. I work for Kenyatta National Hospital, which is the country's biggest referral hospital. But I also work in private practice, and especially at a children's hospital, at Gertrude's Hospital, which is also the largest private hospital, children's only hospital in Eastern Central Africa. So I've known Faye for a long time now. We rendezvoused on the pediatric fellowship program in Kenya. And so we worked together with Faye coming in as a expatriate support for about, I think it's about 7 or so years.
Yeah, it's been a long time. Yeah. I know.
Yeah. Yes.
Just for Chris's purposes and for Lifebox, can you tell a little
Yes.
bit about, because Kenyatta is a public hospital, how many beds
Yes.
is currently in Kenyatta and how many operating rooms do you currently have?
Kenyatta has a bed capacity of about 1,000 beds.
Okay.
The ORs, the ORs are about 12, 15, 16, 17, about 18 ORs.
Right. And then you have an ICU as well. How many beds are in the adult ICU?
The adult ICU has 20 beds.
Okay. And do each 20 beds, and do each one of them have a ventilator?
Yes.
Okay. What about the new pediatric ICU? How many beds in there? Do you know?
The new pediatric ICU has about 8 cots. It's a small area with about 8 baby cots.
Okay. And does it have ventilators as well, or no?
Not per bed. I think it has 4 ventilators.
Okay. Just curious.
Yeah.
And then, as far as Gertrude's, how many beds does Gertrude's have? Do you know?
Gertrude's has 1, 2, 3, 4, 5, 6. It has 10 beds. Okay. 10 beds. Yeah.
In the ICU?
In the ICU, 10 beds in the ICU, each with a ventilator.
Okay. And then as far as the number of beds in the hospital?
In Gertrude's Hospital?
Yeah, it's because it's much smaller because it's private.
I'm not very sure. Actually, I've never found out, but I think it's about 20 times. So it's about 100 beds.
Okay.
100 beds.
It's much smaller hospital.
Yeah.
So where is Kenya currently? What's the current situation in Kenya regarding COVID-19?
Okay, the current situation is that in the latest press release this afternoon, there are 42 cases, 42 confirmed cases. 39 of those cases are in Nairobi, and the other cases are in Kilifi in the coast. Mm-hmm. The latest is in Machakos, which is Eastern Province. Mm-hmm. And we also have cases in Nyanza Province. So pretty much they're beginning to spread around the country.
How easy is it for you to test in Kenya?
It's not easy. Firstly, we don't have enough kits. So far, it's only patients with compelling evidence that are being tested. There is no room for walk-in testing. It's only evidence-based testing that's happening because we are short of kits.
So you're thinking it's probably way underestimating the amount of positive cases out there.
Yeah, that's the thought. Yeah, that's probably the case. Yeah.
And well, I guess to start with, on a government level, what's the government, I mean, what's their reaction to all of this? Do you feel like they're acting quickly, or what's going on?
Um, I think in the beginning, they may not have quite looked at the impact seriously, but it's slowly evolving. So there's more action. There's more action now than in the first week.
Right.
I mean, than in the first week when the first case came out as positive. There is now more momentum at the moment.
And has there been much, I mean, have they been, are there any rules in place regarding social distancing, anything about the borders? Or are they
Oh
just
yes,
trying to?
no. The rule pretty much that was organized in the sense that the first thing was to close the schools, to come up with the social distancing rules, the public health rules, washing hands, sanitizing, distancing, all that came with the pronouncement of the first case, and has continued to go on, with all the public, with all the radio, TV, social media, all those channels are being used, and that's the message that's being used. The borders are within the country county to county hasn't been closed. It's only today that people have been advised not to leave the city to go up country. The Uganda border closed. The East African borders actually closed. I think it was a country-to-country agreement, but then Kenya also closed the airspace. So, as it has only limited the number of flights that are coming, they're still getting cargo flights coming in. And the minister said today that the reason why that's been allowed is so that supplies, medical supplies and everything can still come in. However, passenger flights were stopped, except I think the last will be done today and tomorrow to evacuate. There are people who need to be evacuated to Germany, and I think there were also people who are returning to the UK.
Got it. What about, have they gone as extreme as the US as far as closing all of businesses except for essential businesses, or like the markets and things like that, where it's so difficult due to social distancing?
All the social all the social places were closed. It's been a week now. All pubs, all bars, all eating places were ordered to be closed. The only areas that are open are the ones who supply food. You can only make an order to take home. No sitting in to eat. So that was closed since. Markets are still open, but I think they're still thinking of how to handle this. They are cleaning up, fumigating, and doing all that, but those are still open.
Okay.
Also, the public transport, they reduce the number of passengers, and with strict instructions about sanitization, washing hands when boarding, coming out. That transport is concerned. Today, they have also, we use the motorbike transport. That also has been given restrictions only to carry 2 people at any time with a helmet, and with both passengers must have masks on. So I don't know how that's going to be, whether it will be enforced and listened to, because that's the challenge we've been having. That rules are made and there is some resistance and unrest in some places. So far, this is what we're doing going forward. We're also having a curfew. So the day starts at 7 a.m. The day starts at 5, but we must finish by 7. So by 4, everyone must be let to go home.
Wow. And then what about at your hospital? I guess it would be interesting to hear that if there's a difference between Kenyatta and Gertrude's, especially because Gertrude's is a children's hospital, but what preparations are being made at the hospital level? Let's start with Kenyatta first. What's been going on? Either is it being done through leadership or through the individual?
There's leadership. The hospital has the rapid response team, which is working together with the national rapid response team. So what has been happening is they give feedback to the national team on a daily basis. They are responsible for taking care of all cases. The cases report that they get the information, and so the ones who then decide what the next steps should be. That is one. Two, we are not doing elective cases anymore. Elective cases have been stopped, and we are only dealing with cases. And so the number of staff that are in the hospital actually has scaled down, but however, in preparation for what is being seen ahead. In terms of training, we've had training, about, the disease, what it means to do this and that, and then how the frontliners are supposed to take care of themselves in terms of, dressing and approaching that area that is, dangerous. However, with that, it's still not the real thing, because I don't think simulation has been done with the actual staff. In fact, just now before I came to the call, I was talking to Dr. Gashi, and so I was asking him, Mark, are you ready? We have not seen any of these things, and we really need somebody to come and do a practical demo so that we actually understand what is what and what the actual steps are. We can only do this practically, not, by watching a video or something like that. So that is where we are at. But staff, we are pretty much on the radar, worried about supplies and, the shortcomings here and there. There are protocols that have been developed in, management, but supplies and coordination is actually going to be the main problem. For example, there are certain category of staff that really should not be there. People with comorbidities and what. There's no official communication on that line. People with comorbidities, they themselves are maybe looking after somebody like a child who can be affected. So we don't have policy guiding that. So we sort of are still, we are still working out, but it's not firm. It's not something that has been, there's official communication, but it's a bit disjointed. It's still it's still work in progress. Everyone is coming with this idea and this idea and this idea and this idea, so that's where we are at.
Is it being led, and believe me, this is the same thing going on in our hospital, and what we've done is we have the administration, but then we have our own COVID task force within anesthesia that's trying to put together some principles around patient care, and I'd be happy to share them with you. I don't think they're all completely relevant, but some of them might be, and there's no reason for us to be recreating the wheel. Obviously, you want to take what guidelines have been put together and adapt them for whatever it is your setting is. So I'd be happy to share all of that with you. But I think simulation, we did that, not enough, but around donning and doffing, around airway management, and around transport in the hospital. All three were considered critical areas, at least for us as anesthesia providers, making sure to know that we are adequately caring for the patient, but more at the same time protecting the healthcare worker.
So
So, I think, and you don't need anything fancy to do that. I think that is stuff that you can do really easily with anything. You just got to put people together and start practicing and putting together some policies for Kenyatta. What do you feel like you guys have enough supplies right now? What's your situation with N95s, those types of things? Do you have them?
No, not in Kenyatta. I don't know whether they have come in, because we have, these things are coming in through the ministry.
Right.
The Ministry of Health will then supply to the various institutions. But I haven't seen that in Kenyatta yet. I've not heard that they've been supplied yet. What we were given 2 weeks ago was just the normal masks, the usual surgical masks, and some bottles of sanitizer. But not those specialized masks yet.
Are there people concerned about that because of the fact that this virus is spread, especially anesthesia providers and people on the front line in the ICU? Are they worried? Because we know that the virus is aerosolized and spread mostly through droplets. Are folks concerned about the frontline healthcare workers who are caring for these patients, as well as people like you, anesthesia providers, getting sick from the patient?
Oh, yes. Well, people are terrified about that. And right now, the conversation that's going on is how, I mean, doctors need more protection because people have actually been running away from patients. No, well, not in Nairobi, but it happened in Nairobi with the first set of patients because they were brought in and people were not ready. So people took off until some semblance of PPEs were given. In the districts, in the counties, it's happening. There's a doctor who's making news because he's categorically said he's not touching, and now he's going for disciplinary action by the county government.
Oh, because the government hasn't made it so it can be safe. No, and we think about in your setting where healthcare workers are a precious commodity. They're not enough, and if they start getting sick caring for these patients, then it really will be. Not only will the patients be harmed, but the infrastructure will be devastating.
That's true.
In your setting, just so Chris knows, what as an anesthesiologist in your setting, what are your primary responsibilities? Is it just for surgery, or what other responsibilities do you typically have?
Actually, now we're being relied on for critical care. So it's for ICU and for surgery.
Got it. Then, so it sounds like anesthesia providers there are really at a risk because have there been much discussion about personal protective equipment at all?
There's equipment. Everybody feels that's where we are deficient, where there's a great deficiency in that area. And we are hoping that in the coming days, probably in the next week, that the government will actually demonstrate that they now have acquired the supplies. But as at now, no.
And then what is KSA been lobbying to the government? And KSA, for the purpose of this, is the Kenyan Society of Anesthesiologists. I know I've seen the guidelines that they put together for the care, which look great, but are they using that to lobby the government and the Ministry of Health to try to get these supplies?
I think all the medical associations are part of the government advisory team. So I want to assume that has been heightened or underlined. So it's just that we're waiting for the response. But for sure, all the medical associations are represented on this task force.
Do you think the other hospitals in Nairobi that are private hospitals, do you think they have the personal protective equipment and N95 masks or equivalents, or no, probably not?
Actually, I work for Gertrude, which is quite one of the big hospitals in the sense that it is a specialized hospital, and I also go to Nairobi Hospital.
Right.
But there's been a lot of discussion on Nairobi Hospital platform this afternoon in terms of the acquiring the PPEs and the masks. So as at today, they still don't have the N95 in yet.
What do you guys do when you have tuberculosis patients? What do you do to protect yourself?
But we just wear the usual
mask.
The usual mask. Yeah.
Do you have any?
The only time the specialized masks have come in is when we dealt with query Ebola cases at that time. But then Ebola, the mask issue again didn't quite come in because it was more of a contact than aerosol.
Right.
But tuberculosis patients it is a daily affair. I've never seen that level of preparation for tuberculosis patients. It's just a normal
deal.
Mask.
Do you have in the hospital, are there negative pressure rooms anywhere?
Isolation rooms?
Yeah, like negative pressure rooms, not just an isolation room.
Negative pressure rooms. Yeah, in some areas.
In some areas.
Like in Kenyatta, in Kenyatta, there's a new area that was set up for isolation. So that has negative pressure rooms.
Okay. So I think if you were to plea to the global or ask the global surgery or global community for help in your setting, what would you ask for right now?
Okay, two of things. One, the personal protective equipment. Number two, information.
Mm-hmm.
there's a lot of information flying in here and there in terms of which drugs do we, this prophylactic issue, about chloroquine and azithromycin, and
Yeah, it's
if we
confusing.
have, yes, proper information, if we could also share the protocols that have been used in places that are already up and running.
Right.
Yeah.
And then I think I have to ask you, just as a person, as a mom, as just a normal person in your community, but also as a healthcare worker and an anesthesiologist, as this COVID starts to spread around the world and probably it starts to spread into East Africa and into Kenya, what do you most fear?
What do I most fear? I fear to be a patient.
Yeah.
First and foremost, that's my fear.
Yeah.
Yes. I mean, I really think that's my number one fear. I don't know whether I need some kind of assurance that I will work and come out safe, but who is going to guarantee that? I don't know.
What gives you the most hope?
Pardon?
What gives you the most hope that we're going to get past this?
Because it is okay, it's a different kind of disease, but if you look at history, we've had these types of things happen and people have survived and lived on. Obviously there are casualties, but it's inevitable that just has to be. Yeah.
All right. I'm going to stop the recording now and chat with you, but that was really good and very, very helpful. Thank you. Let me stop the recording and then I'll keep chatting with you. Let's see, stop. Let's see. Thank you. That was great. I think, yeah, I emailed Nita. I emailed Nita to be like, talking about just putting together some resources for LMIC. Like, for example, the whole discussion that just came up that Sarah Hodges posted on that group, that whole idea about how long should you wait, but how do you clean the OR? Like for us, we clean it, but we also have this ability that the air circulates. We have this filtration system. So if you wait 30 minutes, the idea is that the air is circulated enough that there's no more droplets in the air. So you don't have to wear an N95. She was like, how long do we wait? And the problem is in your situation, like if you don't have an N95, does it even really matter?
I know.
So just, I think, thinking it through some of these types of guidelines and things and there's no right answer, but just trying to create a repository of resources that would be applicable and beneficial could be invaluable,
Yeah.
And probably the best place to host it is WFSA on their site.
Yeah.
I think.
You see, even there was a discussion I saw on the global platform about how you're cleaning.
Oh, sorry, this is my mother. Hold on, what did you say? Go ahead. Go ahead.
About cleaning, cleaning the endotracheal, what do you call it, the laryngoscope, and whether
Right.
you don't use disposables. How are we doing that?
Yeah, that would be good. Did you see the one thing I would see, did you see the whole posting I put about how to make your own N95 masks? That works. And you guys have got seamstress, lots of them in Nairobi. It would be very easy for you to use that platform to make your own.
Mm-hmm. Yeah, there are many suggestions of how to make.
But these have been tested.
Was it the one where you were saying, it was it had made a little bit of many steps?
Yes, that was the mask. The material, you have that material, and the mask there, it was out of the University of Florida, but it shows it shows somebody knows how to sew exactly how to make them. And that material you have in your operating rooms, most likely. It's pretty generic.
We do, yeah.
So I don't know whether or not you talk to KSA about that and see if you could get a team to kind of look into it and kind of be the people trying to help with that.
I guess so. but I don't know. You could resend it,
What do you
and then
mean?
I will send it. I'll send it to the president of
Do you want me to email?
KSA.
You want me to email it to you directly instead of
Yeah,
having?
yeah,
All right, I'll do that. And then you can.
yeah.
Is it still Lewis?
It is a Luis. Yeah, it is
Okay.
Luis.
I'll send that to you. Or actually I'll email you about it and then CC Lewis. I have Lewis's email as well and say, have you guys
Yeah,
seen
yeah,
this? Okay, I'll do that. Well, just
yeah.
Praxy, just stay in touch and let me know what's going on. And let me know if you need anything at all. I can't get you anything, but I can try to get you answers. So either through the
Yeah.
WhatsApp group or feel free to, reach out to me directly. I'm happy to try to help. And I'm worried for you guys. I'm worried about the district hospitals. I'm worried. I'm hoping by some chance it's not as bad there, or else we're in big trouble. But
We're crossing our fingers.
I know.
Oh
And
yeah, we really need a lot of, we need support, including moral support,
yeah,
but you have it there, and that we can talk to you, quickly
no,
ask about this and that.
and if I don't have the answer, maybe somebody I know will. You know what I mean?
Yeah, yeah, yeah.
All righty. Well, get some rest, stay safe, stay healthy, and stay in touch. Okay.
I will definitely be in touch, Faye. Definitely.
Send me your picture.
Oh, wait, okay. On WhatsApp, I will.
No, send it to me or email me. Either way.
I'll email you then.
Okay. If you could do that ASAP, that would be great. Okay.
All right.
Thank you.
Okay.
Bye.
Take care.
See ya.
Bye. See ya.